Reddington Hospital Group has introduced its ArmorShield Medical Center to join the fight against COVID-19 in Lagos. ArmorShield has become the first private healthcare facility to be accredited by the Lagos State government for the testing and treatment of COVID-19. So joining us now to explore further the benefits of this development is Dr. OLUWOLE, the Medical Director of Reddington Zine Lab and Incident Commander, ArmorShield Medical Center, which are components of the Reddington Hospitals Group COVID-19 response. After 3 decades of clinical practice, mostly in the United States, his current focus is on the areas of medical administration, education, and entrepreneurship, particularly as it pertains to Nigeria. Welcome to the program, sir. It's a pleasure talking to you.
Thank you very much. Nice to have you.
Nice to have you, too. I'd like to ask, how has it been thus far?
It's been exciting, challenging, but more than anything else, fulfilling.
Right. Can you break down the challenges? I like to hear the challenges, because challenges make a man.
Well, the challenges have been in the area of trying to create the structure based on the requirements that Lagos State has put forth. As we all know, COVID-19 has had a catastrophic effect on all our lives, both really in every sphere of life. And so putting together a program like this, which is quite an ambitious program under the prevailing circumstances, has been somewhat challenging.
Well, Dr. OLUWOLE, let me take you back. I would like you to break down for the benefit of our viewers what you do at the ArmorShield Medical Center and the relationship between that and Reddington Hospital. And then, of course, there's also the Zine Lab. What exactly do you do in terms of your intervention with regard to COVID-19?
Thank you very much. To start off with, the Reddington Hospital Group found it necessary to set up its COVID-19 response in this format because, we didn't want to treat patients or encumber our patients with COVID-19 cases. And many other medical practices try to avoid it. But it became obvious that as the disease became ubiquitous, there was no running away from it. So that informed why we decided to set up a COVID response team, which we now call ArmorShield Medical Center. And in looking further into how to set this up, we also realized that it was important to have another facet, which was the detection of the virus, which is why we set up the lab. So Zine Lab is the detection arm of this COVID-19 response. There we have a PCR lab which detects the COVID-19 virus. The ArmorShield Medical Center was set up also as in companion with the Lagos State government. It became also obvious that Lagos State government could not, on its own, handle the pandemic because of limited resources, and it was incumbent on those in private practice to also step up and complement the work that Lagos State has done. I must say that Lagos State has done a phenomenal job in terms of containing and controlling the virus in Lagos State. And so we came alongside to complement their services.
Well, this is the first medical facility to be accredited by the Lagos State government to test and then treat. Tell us, how long did the accreditation take? What was the process like, and what did it cover?
The process took about 4 months, and we were required to meet certain criteria to be accredited. So that whole process is what took so long. The infrastructure that needed to be in place, the personnel, the equipment, the training that our people needed to have, especially in the area of infection and prevention control. Those are the things that took such a long time.
Right. Since you guys have been granted the accreditation, what has the reception been like? I'm saying reception in terms of testing and people that probably want to treat COVID in your facility?
The reception has been more to the testing. I think people are more in tune with the fact that they need to, well, in terms of the testing, there are two groups of people. There are a group of people that we say are need to know, and there are a group of people who are want to know. The need to know people are people who have symptoms or who feel sick and want to know if they actually have the disease. There's been a lot of interest from that portion. And then there's a want to know, people who for reasons of travel or for reasons of employment need to know or want to know if they have the virus or if they've infected with the virus. I must say, though, that our primary aim at the Reddington COVID response has been to cater to the corporate customer. In other words, our corporate clients. And the reason we focused on that area is because, as I said earlier, Lagos State has done a wonderful job trying to contain and control this pandemic. But it also became obvious that they needed to channel their energies and resources to the public, to people who were perhaps less, people who were disenfranchised in some way, to the public. Now, that left the corporate clients who also needed coverage based on the fact that they have employees. Their employees work in the environment, and so they're equally at risk for the disease. So we programmed our response to meet the needs of that corporate customer.
Well, Dr. OLUWOLE, a set of questions that may be of interest to our viewers. One, how does testing for COVID-19, how does it work? And how much does it cost on the average per test? And if the patient requires treatment, do you have any projection as to how much it will cost? And then where is your lab located? Where is the ArmorShield center? Is it within the same premises as Reddington or in another location in Lagos?
Okay, I would ask you to repeat that first question.
I said, how does testing for COVID-19, how does it work? What's the process?
Okay, the process is that someone who's interested to test calls our number. Once they call that number, based on their response to certain questions, we determine if they are indeed at risk. If we find that they are at risk, then we refer them to the testing center. Now, for the purposes of, for security reasons, I can't disclose the exact location of the lab, but I can tell you it's in Victoria Island. The numbers that we, for calling the testing center are public, and we'll make them, they're available. As for how the process is done, as you see from the video, samples are taken from both the nose and the throat. And those samples are then taken into the lab, which is a PCR lab. In other words, it's a polymerase chain reaction lab. And there we detect the virus. And if it's at a detectable level, then the report comes back as positive. Now, in terms of the cost is mandated by Lagos State government at a fixed rate, which is 50,400 naira. We don't charge above or below that. That is a mandate that we have from the Lagos State government as part of our accreditation. I believe the other question was about ArmorShield. The ArmorShield Medical Center is located in Ikeja. What we're using right now is a boutique hotel that has been turned from hospitality to hospital. And so there are individual rooms for individual patients. As I said earlier, our focus has been more to our corporate customers. In terms of the cost of care, it really depends on the level of care. Just to give an example, if a patient, for example, tests positive and needs to be treated, there are 4 levels of treatment that we engage in. The first level, depending on the symptoms of the patient, is home care. Now, because the disease is now community-based, everybody is at risk. So when somebody comes down with the disease or feels symptomatic and tests and is positive, the first level is we recommend those who are asymptomatic. In other words, they have no symptoms or very minimal symptoms. We recommend that they stay at home. And what we do for them is we monitor them on a regular basis during the day, 3 to 4 times a day. We provide them with certain medical instruments, a thermometer to check their temperature and a pulse oximeter, which is a device that measures the amount of oxygen in the blood. We monitor them 3 or 4 times a day, as I said, and we keep a record of that. And the way we monitor them is through telemedicine. So in other words, there's no direct contact between our clinicians and the patient's at home. And we monitor them through telephone calls and sometimes through audiovisual means. If we see that there is a deterioration in their condition based on their temperature or that they're not oxygenating well in their blood, then the next response would be to bring them into our facility. Now that engages another part of our program, which is the emergency response team. We have ambulances and we dispatch an ambulance to pick up that patient and bring them into our facility. The next level of care would be for them to be isolated in our isolation center. If their symptoms become worse, then we have the next level, which is the high dependency unit, where someone may be oxygen dependent. And if they deteriorate further, then we bring them into the ICU, which is where we have the ventilator support and other organ support systems.
Well, you haven't talked about the cost of treatment. You didn't put a figure to it.
As I said, it really depends on the level of care. And mind you, as we said before, this program was designed for corporate customers. Obviously, we don't expect individuals to have to pay, would not be in the position to pay as much as a corporate customer would. The cost is really not of importance right now. I think what's most important for me to emphasize is that we do have these various levels of care. And I want to emphasize for people that this disease, in 80% of people, they have very minimal symptoms. 40% of people are totally asymptomatic. 40% have very mild symptoms. So there's a 20% group of people who may need hospital care. Out of that 20%, only 1% of people will need intubation, which is, of course, the most expensive care. That can cost, in the millions of naira. But most people, because their care would most likely be home care, and that the cost is bearable.
Okay. Dr. OLUWOLE, stay with us. We'll go on a quick break and we're back to talk some more, especially with other facilities that have been accredited to treat across the country. Why should I go for ArmorShield? That and many more when we return. Stay with us. Welcome back to the Morning Show here on the Rise News, and we still have with us Dr. OLUWOLE. He's the Medical Director, Reddington Zane Lab. Thank you so much for staying with us, Doctor. And just to reiterate my question before that break, there are other medical facilities that are only accredited to treat. So I'll talk about the treatment now, and perhaps maybe even talk about testing. Why should I go for ArmorShield? Why don't I choose some other place, or perhaps even the Lagos State government provided facility? Why is ArmorShield different? And then for a population of almost 200 million, we've conducted barely 400,000 tests. So there is a demand for testing. Are you able to handle that demand? What is demand for testing like at the moment?
Thank you very much. Quite a number of questions there. Before I unpack that, let me go back to the last question. Very briefly, when you asked about the cost of care. And I'll just give you an example of a scenario, so to give perspective. The cost of testing is 50,400, as I said, and that's mandated by Lagos State. Now, because we're aware of the cost of care and how important this is, we do have programs designed especially for people, for individuals. Now, I'll give you an example. If someone in a family of 5, for example, comes to us and tests positive, the immediate concern of that individual is that, how do I go back to my family? What's the risk to my family? Will they get infected? Now, we know from experience that when a family member gets infected, 60% of members of that family will also be infected. So we have a program whereby if someone comes in and tests positive, and say they're a family of 5, that means all the family members also have to be tested. So that's an additional 50,400 for 4 people. So here we're talking of close to almost 260,000 naira. Now, in order to alleviate that burden, we have packages for individuals where, for example, that individual, we have a package where they pay, for example, 1 million naira. That 1 million naira now covers the cost of testing for all the members of the family, and also includes treatment for the members of that family within home isolation. In other words, we monitor all 5 of them. We provide them with the medical equipment that we talked about for measuring their blood oxygen. And if their care should escalate, then they also can come into our treatment center and their care would be discounted. So that's just to give some perspective. Now, back to your question as to why someone who needs treatment would come to Armoured, to our program. Okay. First of all, as we said, we have testing facilities. So if someone has a suspicion, they come into our lab, they're tested, and they test positive. There's no need to start looking for where else to receive care. Now, other laboratories are available, and they do a very good job of testing. But if you go to a laboratory and you test positive, you're now faced with, where do you get your care? So because of that seamless integration of both testing and treatment, that affords us, or rather that gives some comfort to people who come to us. So as I said, if you test positive and you're at home, we have an ambulance system that will come fetch you, take you to our testing facility if you need to be in an isolation center. And of course, we have levels of care that escalate. The other thing that is also important to note is that COVID is not, in and of itself, the only disease that people have. For example, we've had patients who have other conditions. For example, you might have a woman who's pregnant, and she tests positive for COVID. But COVID may not be the most symptomatic part of her experience. So she needs care. She needs delivery. Her child needs care. So we provide all those other extras. So we're not just treating them for COVID alone, but we have an all-encompassing treatment plan. The other thing I would point out to also is that because we have a network of facilities and providers, we have a wide catchment area where we can do our testing. So, if you live in Ikeja, you have access to a sampling facility there. So we can collect samples from pretty much all parts of Lagos and channel them to our laboratory in Victoria Island.
Oh, you talked about your corporate clients. And with airlines reopening very soon and saying, you must get COVID-19 tests, and is there a possibility for partnership with some airlines? Is that in the works?
We have spoken to some airlines, and we have spoken with third parties who are trying to bridge that gap. So yes, there are partnerships there. Again, I must stress that we don't charge above the cost that Lagos State has mandated us to charge, which is at 50,400.
But I also want to ask, if those deals sail through, what would be the logistical implication on your part? Like, how many tests can you do in a day? What's your turnaround time, since you're still doing PCR testing and the likes?
Okay, that's a very good question. In our lab currently, we have the capacity to do as many as 400 tests a day. Okay. We can ramp that up fairly quickly, and those are things that we've already anticipated. So as cases, as demand increases, we have the capability to ramp up, to scale up in terms of testing and also in terms of even treatment. As I said, because we have such a wide network of facilities, we have the ability to ramp up even in terms of treatments.
Well, Dr. OLUWOLE, we have just about 2 minutes to go. So quickly, have you started admitting patients?
We have.
And then why the name ArmorShield? There seems to be some crusading tint to that name. Why did you choose ArmorShield?
The name came by inspiration to the Chief Executive Officer of Reddington Hospital. And it's based on the fact that we view our employees as very special, and we want to keep them safe when they are treating patients or testing patients. So that's where the armor comes in place. So we provide our employees with the armor to treat these patients. But beyond that armor also, if you look at the shield, you see that there's a cross on the shield. And that is, the significance of that is that, you know, we may do all we can, but ultimately it's all up to our God. And so that's the basis of the armored shield.
Well, as doctors say, we care, God heals. Well, correct. Thank you very much, Dr. OLUWOLE, for joining us on today's edition of The Morning Show. Thank you.